Hi, Tony DeWitt here. I am a Missouri appellate attorney and I try to make the law make sense here on YouTube. Today we're going to be talking about medical negligence, or what some people call medical malpractice. Medical negligence is, I'm going to separate the terms here. Medical negligence is the act or series of acts that do not meet the standard of care for a particular person or profession and that produce some kind of injury in the patient. That is medical negligence. A medical negligence claim is different from that. And whether you call it medical negligence or medical malpractice, it doesn't really matter. The bottom line is there are certain things that you have to prove in order to have a claim and to prevail on that claim. And it is a lot more difficult than people think. Now, let's talk for a moment about whether or not medical negligence happens. Of course it happens. Many of you know I was a respiratory therapist for 13 years, and when I was a respiratory therapist, I made mistakes. Every respiratory therapist I worked with made mistakes. Pretty much every doctor I worked with made mistakes. The fact of the matter is, the reason they put erasers on pencils, and I might add the reason that people prefer word processors to typewriters, is that everybody makes mistakes. It just happens. But a mistake does not necessarily equate to medical negligence. In fact, medical negligence is something completely different. Let's talk for a moment about the standard of care. The standard of care is what a reasonable practitioner would do under the same or similar circumstances. So as it applies here, a physician is negligent if he or she fails to use the skill and care that a reasonably careful physician or nurse or therapist would have used in similar circumstances. This level of skill, knowledge, and care is sometimes referred to as the standard of care. To use an example that comes to us from everyday life, a reasonable person on seeing a stop sign would step on the brake and come to a complete stop and look both ways before they went across the street. A person who was negligent would either fail to see the stop sign because they weren't paying attention, or they would simply ignore it and run right through that stop sign. Now, the fact of the matter is, people run stop signs every day. The bottom line is that if someone speeds through a stop sign but doesn't hit anyone, they may have been negligent, but they didn't cause any injury. It's very much the same thing in hospital care. One of my first cases as a lawyer involved in respiratory care type malpractice, I had a woman whose husband was a good friend of the physician. She went into the hospital, and during a procedure, she had a medical error that occurred. The medical error was caused by the doctor. The doctor tied off an artery that he should not have tied off. As a result, she sustained an injury. That wasn't what she was upset about. She had been given the medication of the woman in the bed next to her. Not once, but twice. She'd been given the meal tray of the woman in the bed next to her several times. She was constantly having to remind the nurses who she was. And by golly, she wanted to sue that hospital. So we got her medical records, we evaluated it, and we found out she had a pretty good claim against the physician for what he did. It was negligent. We talked to her about it, and she said, I don't want to sue the physician, I want to sue the hospital. And I said, but the hospital didn't cause your injury. And then she related all of those things I just discussed. And I said, yes, but those did not cause the loss of use of your appendage. And she said she didn't care. She wasn't suing the doctor. She wanted to sue the hospital. So we declined the case. We can't sue for a person when there is no claim there. So we declined the case. From this, I discovered a very significant truth. And that is, people don't sue people they like. They really liked this doctor. The husband and the doctor went and played golf together frequently. As a result, they just would not consider suing the physician. And so, one of the things that I tell professionals when I speak to professionals is that the best malpractice insurance policy you can't buy is a good relationship with your patients. Unfortunately, in the hustle and bustle of the medical world, sometimes people get overlooked and marginalized, and that is unfortunate because so much of what amounts to medical negligence comes about by virtue of bad communication and failure to listen. So what is medical negligence? Medical negligence is quite simply not adhering to the standard of care. It's failing to do what a reasonable practitioner would do, or it's doing what a reasonable practitioner would never do. And if you have that kind of error, that kind of medical negligence, then you potentially have a lawsuit. But let's be clear here. A bad outcome does not mean medical negligence. Bad outcomes happen. A mistake does not mean medical negligence. It is perfectly possible for someone to misdiagnose a cause of an acute injury and still have acted within the scope of care. While I worked as a respiratory therapist, we had a gentleman who was heating up PVC pipe in his basement with a blowtorch in order to make some PVC furniture. PVC, which is short for polyvinyl chloride, when incompletely combusted, produces something called phosgene gas. Phosgene gas was a gas that was used during World War I. It is what's called poorly soluble, which means it doesn't go into solution in the lungs in the upper airways. Chlorine gas, which if you breathe it in, goes into solution and becomes hydrochloric acid, so it's very irritating and you get out of that environment. But phosgene gas, you don't know you're breathing it in. And so it goes down deep into the lungs, and there it converts into hydrochloric acid and destroys the lung tissue. Well, a gentleman came in and he was having terrible difficulty breathing, and he was having what we call pulmonary edema. Blood was leaking across his alveolar capillary membrane. And it certainly appeared that he had some kind of cardiac abnormality, even though he was only 34 years old. The doctor who was in charge took him to the cardiac cath lab, cathed him, and found a normal heart. Transferred him up to the intensive care unit, where he died about 6 hours later. Because once you've been exposed to phosgene gas, your lungs are usually pretty permanently damaged, and the gentleman didn't survive. Was it a misdiagnosis? Yes, he got the wrong diagnosis. Was it medical error? Yes, it was medical error. Was it medical negligence? No, it was not medical negligence. Because the doctor did everything a reasonable and prudent practitioner would do. The most significant cause of pulmonary edema is cardiac difficulty. He ruled out cardiac difficulty first. That is exactly what he should have done. So, let's be clear. Medical error and medical negligence are not the same thing. And a recovery predicated on mere medical error almost always fails. In order to have a medical negligence claim, a person has to prove, first of all, that there's a duty, and in a medical negligence claim, the duty is the duty to act as a reasonable and prudent practitioner, or it inheres from the relationship between doctor and patient. A breach of that duty, in other words, a breach of the standard of care, the doctor did not do what he was supposed to do. and damages, meaning someone is damaged either economically or non-economically such that they can recover. And finally, that the damages were caused by the medical negligence. Causation is often a hang-up in medical negligence cases because many times there are other alternate possible explanations for what happened. I'll give you an example. Several years ago, there was a claim where a physician inserted a pacemaker, and he inserted the atrial leads, the ones that pump at the top of the heart, into the bottom of the heart. And he inserted the blades that were supposed to go into the bottom of the heart into the top of the heart. So instead of the heart going lub-dub, it was going lub-dub. And the blood was going in the wrong direction. And the gentleman developed what's called congestive heart failure. Unfortunately for him, it wasn't discovered in time, and he passed away. The defense that was used in that case was that it wasn't the failure of the physician to put those leads in the correct place. It was a sudden viral illness that attacked the heart and caused the death. Now, ultimately, they came to the table and negotiated, and the case was settled. But this is how causation is used many times to confuse juries and produce a good result for doctors. In fact, one of the things that you should know before you go to see an attorney about medical negligence is that about 75% of the medical negligence cases that are tried to a jury are defense verdicts. And the reason they're defense verdicts is because nobody wants to think that their doctor is a complete moron, so they don't like to believe that someone else's doctor is a moron either. And while that is somewhat unfortunate for the person who has been damaged, it is unfortunately the way the world works. So as a result, most medical malpractice firms will not take a case unless they are absolutely sure they can convince a group of 12 people who do not know you that you have been wronged and that the doctor is responsible. The next thing we need to talk about is damages. There are two kinds of damage: economic damage and non-economic damage. Economic damages are things we can replace with a checkbook. For example, if a husband is seriously injured and his responsibility was to mow the lawn, fix the cars, change the oil, that sort of thing, we can put an economic price tag on that because we know we can hire somebody to act as a mechanic. We know we can hire somebody to cut the lawn, and those all have economic value. Those things can be recovered, and in most states, the economic damages are not capped. Non-economic damages are things like pain, suffering, disability, disfigurement. All of these things are things that you can't put an economic price tag on. In most states, there is a cap, and that cap is usually somewhere between $250,000 and $750,000. So that's it. That's the story of medical negligence. I hope you have found this educational and helpful. If you have, I would really appreciate it if you would smash that like button for me. And perhaps more importantly, if you haven't already, click over there and subscribe to our channel. Because if you subscribe to our channel, first of all, it lets everybody else know that this is good content. And also, if you click on the notification bell, you'll get a notification every time I release a video here on this channel. So thank you for watching, and have a terrific day.